Let's go ahead and get started. So, my name is Katie Stewart. I am the Director of Healthcare Ratings at Leapfrog. And today we are going to be talking about how to get the most out of your custom benchmarking report. We're going to go through a few things. So, this is a webinar really designed for hospitals to understand what's included and how to interpret your complimentary summary report that you receive, as well as discuss some additional reports available to you that have really been enhanced this year to provide you greater insights into your survey results. So we'll get into that now. If you have a question, please go ahead and use the Q&A function. You should see that in the Zoom toolbar. I'm joined today by some of my colleagues who will be able to assist with your questions and also pausing and certainly leaving time at the end to answer any questions that you might have about the reports or how the program works. So we do hope that you'll ask those questions. Really, that's a key component of today's webinar. So in terms of your complimentary summary report, these reports were emailed to your hospital CEO and primary survey contact if you submitted your survey by June 30th. They do include any updates you may have made through August 31st. And I want to point out that these reports were only sent to your hospital. So it's only available to your hospital and it's based solely on responses to your 2025 Leapfrog Hospital Survey, specifically those that were submitted by August 31st. So none of the information included in this report is publicly reported. These reports, again, were emailed in September. And certainly, if you have not received it or have misplaced it, you can reach out to our help desk. I'll have more information on the next slide on how you can gain access to that report. So what's included, and I'll share a screenshot of a sample report, certainly on the next slide for those of you that might not have a copy in front of you, but you're going to see your overall value score, which is based on your overall performance on the Leapfrog Hospital Survey, as well as that average value score that we see for hospitals across all hospitals nationwide. So those participating in the Leapfrog Hospital Survey, and your hospital's domain scores, which I'm going to talk just a little bit about. So it's helpful to have a brief overview of the methodology. We do provide a full detailed methodology document. For those of you familiar with Leapfrog, hopefully you know by now that transparency is very important to us. So not only do you have your survey results transparently reported, but we make the methodology available for all of our programs. So while these scores aren't available publicly, you will be able to access that methodology document and understand exactly how we calculated those scores that are used in that complimentary summary report and subsequently available to you in the additional reports we'll talk about today. So briefly about the methodology, and again, you can look at that methodology document for more details, but hospitals are assigned a measure score for this program. And we do so in a way that's really easy to interpret. So it's a 0 to 100 scale, with 0 being the worst performance and 100 being the best. And we do this for 45 measures from, again, the Leapfrog Hospital Survey. And they're grouped into 8 domains, which are listed on this slide, and I'll go through them briefly. Oh, this is the only program that summarizes the performance for all survey measures into an overall value score and also breaks it by domain. So for those of you familiar with how Leapfrog publicly reports survey results, we do so by performance category, meaning, it's achieved the standard or 4 cell phone bars, considerable achievement, or 3 cell phone bars if you're looking at our ratings website. This program is using a methodology to translate that again into a numerical score that's easy to understand, and in turn allows Leapfrog and you through way of this report to see how your overall performance compares to others on the Leapfrog Hospital Survey. And the domains that we include, there are 8 domains. They're weighted, the measures are weighted and used to calculate domain scores, and again, the overall value score. The domains include medication safety, so things like barcode medication administration and computerized physician order entry, inpatient care, including things like nurse staffing, patient rights and ethics, such as billing ethics, infections, which are those 5 healthcare associated infection measures, outpatient procedures, things like medication safety for outpatients, maternity care, including all of those maternity care measures like episiotomy, C-sections, high-risk deliveries, pediatric care, things like CT dose for pediatric patients, and adult complex surgery, which are those high-risk surgical procedures. So here's a sample summary report. Again, you're going to see all of those 8 domains and that overall value score. Just a reminder, as I mentioned, this was sent in September, specifically September 25th, to your hospital CEO and the primary survey contact. It would have arrived via email. Again, if you did not receive your report, you can contact our help desk. Otherwise, hopefully you have a copy in front of you so we can walk through it. But you're going to see again at the bottom in the blue, your overall performance on the survey, which is represented with your overall value score. It's going to range from 0 to 100. The higher that score, the better your performance on the survey. And then you're going to have access comparison to the national average for that overall value score and see how your value score compares. Now, keep in mind that if a hospital, and specifically for those domain scores, if a hospital declines to report on a measure, they receive a score of 0 for that measure. So if you chose to only report to those voluntary sections of the survey, that would have an impact on your domain score. It also has an impact on the overall value score and that national value score. So one of the easiest ways to improve your value score is to report on all applicable measures on the Leapfrog Hospital Survey. We encourage hospitals to be transparent about their performance and submit the entire survey. And certainly, not only is that going to improve your value score and domain scores, but it's also of utmost importance to patients and your community. So on this report, you take a look at your domain scores as well. They're going to range from 0 to 100. Again, the higher the score, the better your performance. I'm gonna take a look at our Q&A just to see if there's anything before we go ahead into more information about our additional reports that we have available to you. So again, we are gonna make a recording of today's webinar available. In terms of the methodology document, you can find that on our custom benchmarking report website, which I can bring up towards the end of the webinar. I'll make a note to kind of show you where you can find that. But also we'll be sure to, in the email you'll receive after today's webinar, a link will be included as well that will direct you not only to where you can see that methodology, but the slides as well. It's all going to be in one place. And before I move on, okay, great. So I think those are all the questions that we have so far that my colleagues have addressed. Actually, so I'm going to take some of these questions. So if you don't submit certain sections, will that be counted against you? So great questions. So as I mentioned, if we go back just to the methodology, and we kind of kept it really high level here, but if you look at that methodology document, again, that's available on our website, you'll see that a score of 0 is assigned for any measure where you decline to respond. So for example, there are required sections of the survey, but if you didn't submit section 3, which is the adult complex surgery procedures, you would get a 0 for all of those measures. So certainly that's going to bring down, not only have an impact on that domain score, assigning it a score of 0, but it's also going to have an impact on your overall value score. This program, again, is a summary of survey results. And really that overall score is to reflect those, how you performed overall in the survey, and being transparent and reporting on all, the entire survey is a big component of that. Another question I'm happy to clarify about the benchmarking reports. So we got a question asking if the benchmarking reports are publicly available or available for purchase to any entity outside of the organization that is scored. So no, they're only available to your hospital and health plans that license our value-based purchasing program and use this information. So they are not available or available to purchase, for example, for if you wanted to purchase a report for a competing hospital. Really, they are only available to you as a hospital or as a health plan that licensed the data for that purpose. And the way that program works is instead of you purchasing, a hospital purchasing the report, they also make the report available to you as part of contracting. So those are the only ways the reports are made available. And again, it's not publicly reported. Okay, so I'm going to move along. And again, my colleagues are answering some of these questions. Um, Again, if you have other questions, you can certainly put them in the Q&A. And myself and my colleagues on the call will be happy to assist. So we went through the complimentary summary report, which you get complimentary for free as part of a participation, and really our thank you for participation in the survey. You get that if, again, you submitted by June 30th, and it has results available as of August 31st. So we do offer an upgrade to the complimentary summary report that each hospital receives, and that's the premium custom benchmarking report. So while the summary report shows your domain scores and your value score, with the premium report, you can gain more insight and see where your hospital's performance falls compared to the other participating hospitals nationwide in the survey, as well as in your state, and compared to a custom cohort of your choosing. So you get to choose. You can choose hospitals with similar characteristics, such as your bed size. You can choose hospitals in a certain region, hospitals that are safety net, children's hospitals, etc. So there's a lot of options available to you there. And your report is going to include not only these comparisons for the nation and the state, but also for that cohort of your choosing. And you get those comparisons for your overall value score, each of the 8 domain scores, and the 45 measures included in the calculation of the overall value score. Again, all derived from your performance on the Leapfrog Hospital survey. So I think I saw a question come through, and just a reminder, this data is based on your responses to the Leapfrog Hospital survey. In addition to all of that, you are going to get trends in performance by individual measure. So you'll be able to see how you performed this year on the 2025 survey compared to last year by measure, and also receive a PowerPoint deck or presentation that can help aid you in one, understanding your report and communicating those results to your hospital leadership, or whomever you want to share those results with, whether it be staff, board, etc. Just a quick comparison of what's included in each report here. So again, we've talked about what's included in that free report you receive, and then the additional information that that premium custom report is going to provide to your facility. You're going to get distributions of the overall value score nationwide, as well as for your state, and that custom cohort. You're going to get that for your domain scores, individual measure scores, trends, and again, that PowerPoint. I want to go quickly through what's new. So I mentioned that these reports have been enhanced. We really did take a deep look at what we were providing and wanted to make it easier to use, easier to understand, and hopefully of greater value, what we feel to be of greater value to you as a hospital, so that these reports can be used for quality improvement. So these new, before we dive deeper into what's included in the premium report, if you're completely new to it, I do want to share some information about what's changed. So I mentioned it's an easier to follow structure and organization. We're providing you with your hospital's value score first, and then drilling down further into those domain scores that get used to calculate the value score and the individual measure scores. There's also updated visuals, and I'm going to share examples. There's an example here on the right. These are provided for your value score and each domain score included in the calculation of your overall score, showing where your performance falls compared to other hospitals nationally, again in your state, and for that cohort of your choosing. There's also a dynamic summary, which is shown at the top here, of your overall performance, indicating if you are performing better than, worse than, or similar to other hospitals nationally in your state, again, nationwide, and for your custom cohort. So additional information available to you here. We also have 45 measures included in the report this year, and 8 total domains, which is an increase from last year's reports. So now we'll go a bit into more detail and show what's included on the various pages of the premium report. A sample is also available on our website. You'll have access to this recording and slides, so you can click on that link there to get to the sample. But again, this is all provided on our custom benchmarking report website, which after the slide deck, I will try to show you exactly where to navigate it. And also in the email that you'll receive after today's webinar, we'll have a direct link. So these reports are designed for hospitals using the survey results for quality improvement, as well as leadership engagement, which in general, all hospitals should be doing, and this is just making it a bit easier for you to do so. So we talked a little bit about the report, that first page, the value scores. But going through some examples of what's in this report, again, first you'll see an updated visual, and this is what we call a lollipop chart. And I won't go into too much detail, but what you'll see is that for each cohort, the national, the state, and that custom cohort, they each get their own lollipop chart. And this is really a visualization that uses a line to show the range, the distribution, the min and max values of those scores for in this case, the value score, and then those circular markers to highlight key data points. things like the bottom quartile, the median, and top quartile. And then your score is shown in blue so that you can directly compare it to that distribution. And at the top of this, you'll see that custom interpretation that I mentioned previously. So you can really use that to summarize your performance and have a greater understanding of where your value score compares to the nation, your state, and that cohort of your choosing. The report is also going to provide these same visuals and information for each of the 8 domains. So this is just a snapshot. There's 3 domains on this page. Again, it's those lollipop charts and providing that distribution compared to your domain score, which is shown in blue here. As in past reports, you have a table showing your hospital's measure scores for each of the 45 applicable measures, and they're displayed alongside averages for the nation of national reporting hospitals to the survey, your state, and that cohort of your choosing. Here, so that you can better understand the methodology as well, you'll see how the measures are weighted and how those domains are weighted and then used to calculate your value score and domain scores. And then you'll see a custom color-coded comparison that compares your measure score to that of the national average. And that's provided for each of the 45 measures included. We talked about performance trends, so you'll see here that you can see how your performance for each measure compared to last year's performance on the 2024 Leapfrog Hospital Survey. And there's a visual provided so you can see, did you perform top performance in both years? Did you have an increase, decrease, or was it similar to prior year's results? So an additional option that we added last year is a Premium Plus report. So this includes everything in that Premium report that we just reviewed, as well as a tailored analysis by a Leapfrog expert that's delivered in an executive report to you, as well as additional slides with that custom analysis and a 1-hour live presentation for leadership or whomever you want to include, like other stakeholders. That's delivered by a Leapfrog expert and includes a live Q&A that's tailored to your organization for that live presentation. This is designed to help you better understand your results and performance, help you design your own quality improvements and work with your teams to, work on those areas for where you're seeing lower performance. So this additional analysis can help you better understand, those areas where you're doing well or where you need to improve so that you can go back to your team and staff and work with them to sustain that performance or perhaps make improvements. For those of you that are in a health system, whether that be small or large, Leapfrog can create a custom cohort. We love that saying. How many times can I say that today? That includes just your system hospitals. So this allows systems to compare the performance at each hospital to that of the entire health system. It can be used to identify those strong facilities in your system, certainly ones that maybe can share best practices for those other hospitals in your system that might be in need of improvement. So what systems or hospitals get with this is, again, benchmarking compared to the entire system, as well as individual reports for each hospital that's going to include that system cohort and allow you to compare performance across your system. So now we've talked a little bit about the different reports available to you. So how can you use these reports? So we've talked a lot about this, but really they're used to benchmark performance at the individual measure level, domain level, and using that overall value score. Benchmarking your performance to those hospitals nationally that participate in the survey, those that participate in your state, and again in that cohort, whether it be your system or a cohort such as your region, bed size, hospital type, etc. Another purpose and great use of these reports is to inform and engage your board and staff so that you have these really easy to use and interpret scores on a 0 to 100 scale, and those can be used to better inform leadership and staff on how your performance is falling on the Leapfrog Hospital survey. How well are you doing? Or maybe where do you need to improve? And then also, last but certainly not least, inform your quality improvement efforts by identifying those process or outcome-based measures that really need improvement to ensure patients are receiving the safest and highest quality care, which ultimately is really how we want Leapfrog survey data to be used, right? To help you design those quality improvement efforts to ultimately deliver better care to your patients and communities. Just a little bit about pricing. As attendees of today's webinar, we are offering a 25% discount on those premium custom reports and premium plus reports. You can order today, and we deliver those reports in 5 to 7 business days, usually much faster, but they will be readily available to you, again, based on your survey submissions by August 31st. You can visit our website to order those reports. Again, we'll include that link. And that does conclude today's presentation. If you have questions about the reports, you can reach out to our help desk. Again, if you didn't receive the report, you can reach out to our help desk. And now I'm going to just take a look at the questions we received and also pause so that you can enter any other questions you might have in the Q&A. So one question we got, are hospital systems priced differently? So yes, if you are interested in ordering a system report, we do offer a bulk kind of discount on those reports and do have different pricing model for that. So we ask that you reach out to our help desk with information. We'll respond to you, get information on how many hospitals are included in your system, and that are happy to provide that pricing. And again, that system package is going to provide individual reports for each hospital in your system. And what it includes is, if I go back just a few slides, what you would see here, for example, or no, actually on the next slide, where you see cohort, that's going to include the average for your system hospitals. On this page, it's going to include the cohort charts and distribution for the system hospitals. And same with the value score. So it's essentially you're getting those reports for each hospital in your system, and that cohort, instead of here, which the sample is showing it's an adult cohort, that would be just those hospitals in your system. And we're happy to provide ordering information and pricing information in our help desk. Other questions? I'm just going through what's been answered by my team to see if there's any others that we want to pull out. And I do just want to emphasize because I do see quite a few questions on this. But again, the information provided in these reports in terms of the 0 to 100 value score, et cetera, are only available to hospitals and health plans that license the data. So only hospitals can order the report for their individual hospital, and health plans can license the data. So what you see on the survey results website, again, is performance by category, results by performance category. It does not include these scores. And I am not seeing any other questions at this time. I want to thank everyone for joining today and learning more. Certainly, if you have other questions, we would be happy to address them. For those of you that are still on today's call, I'm going to try to switch my screen share to show you where you can, again, find where you can get more information on these reports. So bear with me for 1 second. Okay. So, if you're on Leapfrog's main website, all of the hospital survey materials are available to you under this drop-down hospital survey. You're going to go to scoring and results. And here, this last option here is custom benchmarking. And this is where you can find the recording once it's available from today. You can view a sample. You will see more information that we've covered really today on what's included and pricing, etc., and a direct link to the online store where you can order your report. Now, if you want that specialized reports for your system, again, you're going to reach out to our help desk so that we can assist you. Otherwise, you can order your report directly on our website. Don't forget that you get a discount today that will be emailed to you. And it's a 25% discount. It does expire on October 12th. So we hope that you will take advantage of that. So thank you all for joining. That does end today's webinar. And I hope everyone enjoys the rest of their day.